Mtazamaji, nataka kurejesha tena katika mtaa wa Karen katika makao ya Naibu Rais Profesa Kithure Kindiki ambaye anaongoza kwa sasa hivi kongamano kuhusiana na masuala ya afya hususan Taifa Care, na hivi sasa anaarifiwa kwamba waziri wa afya anazungumza. Hem, tumsikilize.
The CBS for each and the employers will on a priority basis seek the advice of SRC. So concluded was the CBA for Nursing Union for clinical officers is ongoing pending with the Treasury, and the KMPD is to audit the status of implementation of 2017 CBA and present the report for deliberations. For the doctors, additional doctors to support UHC implementation, the government shall establish mandatory staffing norms for various levels. And in furtherance of this national endeavor, the government shall employ 2,000 and thereafter establish a policy for annual recruitment and placement of doctors, pharmacists, and dentists. So a technical working group and steering committee developed a HRH policy, and the Ministry of Health Staffing Norms and Standards reviewed the policy that was developed, and the employment of doctors will be done over a period of 2 years, beginning financial year 2025 to 2026. Funding will be provided for either in the 2025-2026 budget, a budgetary provision of 6 billion is required. And the hiring will depend on the needs and based on the results. The hiring will be at various levels from ministry, county, and at the national hospitals, the semi-autonomous government agencies. Regarding health commodities, KEMSA's mandate is procurement, warehousing, and distribution of HPTs, and it partners with counties and strategic partners. They're using LMIS to collect, analyze, and provide regular HPT reports, and they support counties in health supply chain strengthening. The key role in UHC, accessible and affordable quality health products, and extending economies of scale to the counties. KEMSA, however, faces challenges in endeavor to ensure sustainable stock availabilities. The challenges, you can see stock availability stands at 53%, and order fill rate after back orders on average is 65%. Constraints affecting stock availability, COVID-19, health program, HPTs strain the cash flow, and the long-standing debt of 6.1 billion. Counties contributing 3.5, MOH 1.4, and development partners 807 million. There is also delayed payment to suppliers with 1.5 billion being over 90 days. And you can see the total pending at 2.4 HPT and procurement for 2024-2025, and the projected cash flow needs being 8.5 billion. So key asks to counties to settle the outstanding bills by counties to restore financial stability. That way we can have improvement in capacity at your facilities and also KEMSA. COG to concur on debt remittance of direct remittance of debt from TNT to KEMSA in concurrence with COB, and the COGs again to concur on net off by SHA to KEMSA for SHIF and PHC HPT debt. We'd love to hear more about implementation of that. Then concurrence that KEMSA remains the first choice for all public health facilities. That will be able to capacitate it and ensure that supplies are always there to reach the last mile. Regarding a comprehensive integrated health system, the objective was a national comprehensive health information management system to enhance efficiency, effectiveness, transparency, and accountability. And MOH contracted the consortium led by Safaricom. So for the digital superhighway, you can see those are the components: the health information exchange or the registries, and the health management information system. And those are the systems, the e-claims, SHA, ERP, registration, and National Logistic LMIS. So what have we been able to do so far? For registration, we are happy to report that we have self-registration, assisted registration, employer portal. We had our means testing, but we are reviewing to have the new means testing that will incorporate the various data agencies that we had talked about. For the claims insurance management system, we have the provider portal ready, and the claim payer engine and post office system. They are reviewing and working on the SHA ERP. We've been able to distribute 5,665 devices, and 3,000 are in the warehouse, and 62,000 will be delivered by March. Regarding health information exchange, we are happy to report that we have the clients registry, the health worker registry, facility management system, the health terminology, and national shared health records. Now they are able to be rolled out efficiently. HMIS development was complete, baseline survey ongoing, and HMIS rollout to follow suit. Training, 11,600 have been trained, and 71 physical trainings have taken place. Supportive supervision and mentorship is ongoing. Our key asks, I think we had a best practice from Mombasa, and we want to encourage counties to implement this, with more than 87.5 of their facilities being digitized. And I believe His Excellency the Governor will give a best practice and how he's been able to secure resources and ensure sustainability. So we are encouraging the signing of intergovernmental participating agreements, conducting baseline assessment per county on what is available, and then uploading all the healthcare workers to the Health Pro. So another concern that has been raised is US government funding, and what is the ministry doing about that? As we know, the global fight against HIV, TB, malaria is mainly supported by PEPFAR, PMI, Global Fund, and UNAIDS, and all deriving quite an amount from USG. Kenya has been overly dependent on the donor-driven vertical health programs, and yet there was a stop work order which has disrupted USG funding worth 30.9 billion.